Hello, my name is Kaye Swinney. I'm a locality manager in Sunderland and I have the thematic lead for service user involvement. In Sunderland, we've just completed a survey monkey with 420 clients who have had a contact within the last 3 weeks. I'd like to present to you the background to the survey monkey, the findings and the plans for future development and service. The Harrogate District Foundation Trust vision is to achieve excellence every time for patients and service users. The Harrogate Trust values of being respectful, responsible and passionate run through every aspect of service delivery to achieve a vision of achieving excellence every time. We need to involve the service user and partner agencies to gather feedback regarding their experience of the service. The feedback can also indicate potential themes and areas of development. Analysis of the feedback enables us to continually evolve and improve. Harrogate District Foundation Trust are committed to continuously developing services to meet the changing needs of the population. On the 17th of March 2020, the UK Government asserted its response to the COVID-19 pandemic. Guidance was provided to NHS trusts and local authorities regarding the COVID-19 prioritisation within community health services. In response to Public Health England guidance, Harrogate District Foundation Trust acted promptly to ensure that safe and effective services were still available to meet the needs of the local population. To ensure safety of service users and staff and to prevent the spread of the virus, changes to service delivery were required. Sunderland is one of the 20% most deprived districts in England, with 23% of children who live in low-income families. Those living in deprivation already face health inequalities, therefore those with the greatest deprivation experience a higher risk from exposure to the COVID-19. Those with existing poor health have an increased risk of severe outcomes if they contract the virus. Societal measures to control the spread of COVID-19 impacted further on the economy and therefore had an increased impact on those already experiencing inequalities. Growing Healthy Sunderland 0 to 19 services provide an integrated public health service to young people, children and their families in Sunderland. A percentage of these are recognised as requiring above the universally offered service and having the need for additional support. In response to the needs of the local population, Harrogate District Foundation Trust implemented strategies, invested in technology and invested in the development of staff to enable the service to continue to be delivered, but in a virtual way. In view of the rapid changes and the need to develop a recovery plan, Harrogate District Foundation Trust recognised the need to consult with the service users regarding the service they had received during the pandemic and how their needs could be met in the recovery phase and beyond. The NHS 5-year plan encourages providers to strengthen public and patient participation. It refers to service users as experts by experience. Working in partnership with patients prioritises their needs and improves access to services and encourages more effective use of facilities, therefore reducing health inequalities. Prior to the pandemic, the 0 to 19 service delivered a home visiting service universally to all families from pregnancy to 19 years of age. Those families identified as having additional vulnerabilities or safeguarding concerns received an enhanced service of support. In response to the pandemic, Public Health England made recommendations regarding service delivery for the 0 to 19 services in England. Recommendations were to continue face-to-face contacts for primary visits or to those children who were safeguarded or vulnerable. In order to protect those who were most vulnerable, the 0 to 19 service completed their own risk assessment and worked collaboratively with partner agencies to close the loop and ensure robust communication between services strategically and at operational level. Following risk assessments, vulnerable families were provided with face-to-face contacts, and families with emerging support needs or those requiring a universal service had their needs met via a virtual contact. Key health messages were provided via social media on the 0 to 19 Facebook page and on our YouTube channel. In order to evaluate whether the service provided had met our service users' needs, 420 clients who had received a contact from the health visiting service between the 7th and the 21st of May were contacted via telephone to ask if they were willing to give some feedback about the service. The feedback was gathered via a SurveyMonkey. The questions focused on access, quality, clarity of information, client expectations, and practitioner knowledge and skills. We also asked about preference of the service user in view of future development of the service. There was also an opportunity for further comment from the client and if there was anything specifically they wanted to feedback about their experience. Of the 420 service users contacted, 90.24% received their contact virtually via a telephone. "417 service users reported that the member of staff had introduced themselves by name. However, in the additional comments, service users who reported the staff member hadn't introduced themselves by name hadn't done so because they were already known to the client. 50% of clients reported that the service met their expectations. 48.57% said that it had exceeded their expectations. Many of the participants reported in the additional information that they had received an excellent or outstanding exceptional service and named individual health visitors. All participants reported their questions had been answered. 98.57% reported they had been answered a lot. "413 clients said that the information given was very clear. 5 of those said it was not so clear, and 2 not clear at all. In view of future service delivery, 86% said they would like to be visited at home, and many comments in the additional information reflected their preference to this. There were some concerns from parents about home visits not being completed at this time, although many said they understood that in the circumstances and appreciated the telephone contact or video contact. It was evident from the information that many of the clients would like a combination of contact methods to be offered in the future. Many of the clients reported that they were both happy and surprised that the contacts were slow going ahead in view of the difficulties of the situation. They reported the service and the health visitors lovely, helpful, friendly, supportive, outstanding. They thanked the service for their help, reporting that practitioners had gone above and beyond, exceeded expectations, that they were very professional and always at the end of the phone or text. They reported that they'd felt reassured and had all of the questions answered. They felt that the practitioners were knowledgeable, confident, and met the family's needs. One client reported they preferred the phone call because there was no need to wait in or dash around. One reported that they were nervous about the PPE, it had put them off, but the health visitor was very reassuring. Another said that everything was covered in the call that would have been covered in the home contact. They received good advice and guidance. Some practitioners were named individually: Karen Defty, Kendra Thompson, Claire Anderson, the student health visitor, and Barbara Luke, reporting they were
absolutely brilliant, going above and beyond. Some clients reported that they understood the current difficulties, but added comment saying that they would prefer to see the health visitor face to face. They prefer that the health visitor can see the baby's progress, and they look forward to the home visits resuming. One client reported that English was their second language and therefore face to face was much easier. Another reported that there was lots of excellent advice, but they would have liked to have had a pen handy to write it down. Some reported that they would sometimes prefer a home visit depending on the circumstances. Another reported that the service was below their expectations, but that this was because a home visit was preferred. Several clients reported that they had missed getting their babies weighed, one reporting to even have bought their own scales. In response to the feedback from clients, we have developed an infant feeding virtual clinic via Attend Anywhere. This takes place twice weekly. So far, we've had around about 2 to 3 attendees at each session. We have also launched this week a virtual infant drop-in clinic. This takes place 3 times weekly, and it's been set up to answer any questions and queries from parents and hopefully reassure and give guidance to those parents who were worried about not having their baby weighed at clinic. We are also sharing the information from this survey with staff regarding the positive feedback. We have set up a patient experience working party, and we plan to meet and discuss how we can develop the service in respect of comments from this feedback and feedback going forward. We will publish on our Facebook page, You Said We Did, and we plan to request further feedback via Facebook through SurveyMonkey. We have developed and posted videos on Facebook and YouTube with health information contained. In the future, we plan to live stream an infant feeding session. Thank you to all the early years practitioners who participated in gathering the feedback, and thank you to the team for your excellent service delivery. The feedback demonstrates your ambition to deliver excellence every time.